Hey, thank you for watching today. First of all, since I'm going to be talking about healthcare and Supreme Court nominations and different things in the news, I would like to recognize the death of Senator Ted Kennedy and my condolences out to his family, nieces, nephews, family members, all those remaining, and recognizing him as a great icon in American politics. And despite whatever side of the fence you're on, be it Democrat or Republican, I think we're all going to miss Senator Ted Kennedy, and I hope God has a spot in heaven for him. And my prayers go out and my sympathies to all his family. So I do have a regret that I never got to meet Senator Kennedy, shake his hand. Um, he's been around for a long time, and it's a shame I don't get to meet him personally. And I do regret that. But having said that, sir, I hope God takes you under His wing, and brings you to heaven in the spot. So I know that you cared about people, and go on from there. Well, first of all, when it comes to healthcare, we have a problem. Obviously, one of the major issues is the very high cost of healthcare. And that's a hard obstacle to get around. I've often suggested that basically the best way to cure the healthcare problem is to expand some of the state programs for the lower income children who can't afford healthcare. And as far as the national scene goes, a lot of families can't afford 30, 40, 100, $150 a month anyway. Um, those families can best be served by the standing state programs and keeping those going. And as far as the national healthcare thing goes, I think it needs to be healthcare needs to be left in private hands as far as I can urge some insurance companies to possibly create some nonprofit partner companies, maybe even within their companies, where they could reach out to some of these families who can't afford the current cost of healthcare. And I think they can offer, just like some of the local pharmacies here, they can offer like discount prescription cards. Some There's some here where they pay like $20 for the year to get discount prescriptions. Um, they'll bring down the cost of prescription drugs, and then urge local communities. And there's several models to look at, but I urge the local communities, as far as cost goes, that possibly even some of the doctors can volunteer their time. And the way to do that would be maybe they could have rotational shifts in our office, possibly rotate shifts, and certain doctors, maybe a day out of the week, volunteer their services to keep the cost of healthcare down and to serve those in the community that can't otherwise afford it. And I think that would be a good public service. And obviously, um, we have to keep the cost down, and that would serve families who can't afford it otherwise. Also, small businesses. Um, I urge the private sector to allow small businesses to have group uh, group plans, to buy into group plans and keep their costs down. And so let's not forget about small businesses when we create these things. So I challenge all, Blue Cross Blue Shield, Humana, all these major companies. Maybe you can show America that you have the ability to answer this problem And senior citizens are afraid a lot of money will be taken from Medicaid, which obviously we can talk 10 ways about one subject, but when you take money from a program, eventually it's going to show up somewhere. So I know the senior citizens are nervous about healthcare reform taking money from Medicaid. So I urge the private companies to get it in gear, create some divisions, sister companies that can handle some of these healthcare issues, allow prescription drug coverage at discounts, maybe get some of your network doctors to volunteer some time, and then we can serve everyone in the community. Otherwise, I had a pet that was hit by a car one time, and it was a 2-hour wait just to get over there. And I found myself, nursing this pet to health and everything. And you hear about these long waiting lists and everything to get into in these countries that cover health care for all the people, all their citizens. You hear about these long waits and these sometimes substandard care facilities. So I think we can keep everybody in business now who's in business. People who have their health care can keep it. Companies that are still in operation, who won't lose jobs. The insurance companies won't lose investments they have, and be driven out of business by some kind of public option. This is America. We are a democracy, so we need to keep it as such. The cost is so astronomical. I think there's other ways to handle this. So any improvements to my ideas are welcome. And outside, there's mosquitoes out here. But any improvements to my plans are most welcome. And I urge all Americans to keep America a democracy. Recognize the cost of healthcare is astronomical. So if we involve everyone, there's an answer. If we just try to do it a couple of ways, it's going to be hard to do. It'll just end up costing the taxpayer a lot of money. And I remind you, there are examples of like K-Chip in Kentucky and some other states that already offer health care to very underprivileged or low-income families. And I urge everyone to use the system, but to look at that as a role model for service. And I urge healthcare providers, everyone, not to take advantage of these services, not to overbill or not to run the money out of these funds, but possibly even do your part in the community where you can offer some of your services. Maybe possibly, like I said, rotational shifts and free of charge. The costs will keep down and we can serve everyone in the community. It's just simple. It's healthcare costs a lot of money, and the technology costs a lot of money. Look at technology, what it costs to buy equipment, the cost of malpractice insurance, of lawsuits, and the fact that a lot of that money doesn't even go to the person making the lawsuit. It's just it's an astronomical burden, and it's just not something just not something that can be rushed through Congress. So there's ways to serve everyone in the community with health care, but you can't do it in a couple of days rushing a big thing through Congress that leave huge deficits. It's not well thought out, and even if it is, it's obviously there's things we just don't know about yet. So I think you could take some of the ideas I expressed and implement them in your communities, and you can solve your local healthcare issues.